The topic is systemic lupus erythematosus. Systemic means the disease can affect multiple organs in our body. Erythematosus means reddening of the skin. Lupus is an autoimmune disease wherein the immune cells starts attacking the body's own tissues which they are supposed to protect. It's not completely known why it develops. Most probably it is the result of both genetics and environmental factors. Individuals with susceptible genes, UV radiation, smoking, women are more likely to develop SLE than men. It is due to the estrogen hormone that plays a vital role in developing SLE. If suppose a person is having that susceptible gene and he is exposed to the UV radiation, his DNA is damaged and the cell undergoes apoptosis. The little apoptotic bodies, parts of nucleus, DNA, histone, and other proteins are exposed to the rest of the body. The susceptible genes are more likely to think that they are antigens. Since they are from the nucleus, they are called as the nuclear antigens and the immune cells tries to attack them. Also, due to less effective clearance of apoptotic bodies, as the host is not as good at getting rid of apoptotic bodies, there will be nuclear antigens which are circulating in our body. The B cells starts producing anti-nuclear antibodies and these antibody combines with the antigen to form the antigen-antibody complexes. These complexes starts getting deposited in various organs and tissues like kidneys, skin, joints, heart, etc. Then initiate a local inflammatory reaction which causes damage through the activation of the complement system which after a huge cascade activation leaves the cell membrane which is referred to as increased permeability causing the cell to burst and die. The clinical features include fever, weight loss, arthritis, fatigue. 40 to 50% of patients develop malar rash, butterfly rash in the cheek region, which is a characteristic feature of systemic lupus erythematosus. The specific symptoms depends upon the specific organ being affected. In case of heart, there can be pericarditis around the heart. Any layer of the heart can be affected. Endocarditis presents as Lippmann Sachs endocarditis where vegetations form which are essentially clumps of fibrin, a blood clotting protein and immune cells around the mitral valve. You can have a severe abdominal pain. When the antibodies are targeted against the components of blood, it can lead to hematological disorders like anemia, thrombocytopenia, leukopenia. Next, if the joints gets inflamed, patients may develop arthritis. If the kidneys are affected, patient might develop renal disorder like abnormal amount of urine protein can be excreted, diffuse proliferative glomerular nephritis, inflammation of the glomeruli. Pleuritis when the lungs are affected. The oral manifestation. 5 to 25% of cases shows oral manifestation. The areas affected are palate, buccal mucosa, gingiva, vermilion zone of lower lip. Sometimes appear as lichenoid areas. There can be varying degrees of ulcer, pain, erythema, hyperkeratosis. Other chief complaints are xerostomia, stomatodynia, candidiasis, periodontal disease, and dysgeusia. The histopathological feature shows hyperkeratosis, thickening of the spinous layer, degeneration of the basal layer, and subepithelial lymphocytic infiltration. Patchy deposits of PAS material can be seen in the basement membrane with subepithelial edema, deep inflammatory infiltrate often seen in a perivascular orientation. The diagnosis depends upon the anti-nuclear antibodies, but they are not specific. Antibody against double-stranded DNA and anti-Smith antibody is shown to be more specific to SLE. Diagnostic criteria depends upon the following: malar rash, discoid rash, photosensitivity, oral ulcers, arthritis, serositis, renal disorder, neurological disorder, hematological disorder, immunological disorder, anti-nuclear antibodies. When above 4 is met, then we can give a diagnosis of SLE. Treatment: avoiding sun exposure. In case of mild cases, NSAIDs with anti-malarial drugs such as hydroxychloroquine can be administered. In severe cases, systemic corticosteroids with other immunosuppressive agents can be given. Prognosis is variable. Death is usually due to renal failure, malignancy, and infection.